We have Nancy Kaufman here today she is a co-founder of Multiple Myeloma Opportunities for Research and Education. We have Margie Fraser, who will follow her. She is the Executive Director of Batten Disease Support and Research Association. And we're very happy to have both community organizations represented here today. Then Dr. Peter Stanich from the Division of Gastroenterology, Hepatology and Nutrition, and Sharon Cross she's a program director in patient and family-centered care. So we will move on to Nancy from MMORE, and we'll get out of your way here.
I need to know here.
I don't think so. Just you can push next. You go there.
Okay. Good morning. Can you all hear me all right? I'm Nancy Kaufman, as Jeff said, and I'm very pleased to be here. I'm a co-founder and president of MMORE, and as with many organizations that have been created for rare diseases, our family started MMORE 7.5 years ago after one of our daughters, Sarah, went into remission for having been treated for multiple myeloma. So multiple myeloma was a world we had never heard of, and we were thrown into it. I'm very grateful to be able to tell you that our daughter is doing very well. She's thriving, but it was a very scary time, and Sarah had chemo and radiation and a stem cell transplant, and after Sarah went into remission, we decided we needed to take action. We're very hopeful about her future, but myeloma has a very high recurrence rate. We were told the statistical survival rate was 2 to 4 years when she was diagnosed in 2005, and we needed to take action. You won't find more passionate people than the family members and loved ones of somebody who's been affected by a rare disease. So that's my first hint to you, is that go to those people and we'll help you find patients for your trials. As I said, I'm very pleased to be able to say that Sarah's doing well. In December, she threw a big party to celebrate the 10-year transplantiversary of her stem cell transplant, and she's thriving, she's married, and she has a 1-year-old daughter. So life is good, but she still needs to get tested every 3 to 4 months. So myeloma is ever present in our lives. I want to especially thank you all for your commitment to research for rare diseases. Our family started more so that we could do what we could do. We're not the scientists, but we can help to raise awareness about this rare disease, and we can help to raise funds. But we need you to carry out the science. We're counting on you, and I thank you for your dedication. In Dr. Griever's slide with the pipeline, where MMORE functions most fully is at the very, very beginning. We provide seed funding for getting ideas off the shelf and into the pipeline. We're a grassroots organization. To date, we have funded $3.1 million in research since we began in 2008, and it's all grassroots. It's people who could be sitting here with me who have dedicated themselves to this. So now, on to some ideas. Unique challenges have already been addressed by Dr. Griever. For people who have been diagnosed with a rare disease, there's no context. All of us are aware of breast cancer. We're all aware of prostate cancer and leukemia even. But when you hear a diagnosis, for instance, with multiple myeloma, there was no context for that. We didn't have anyone to turn to who we knew had already been through this experience. That's scary. Patients need to quickly become educated about their disease. And where's the first place they look? The internet. Worst place to look first, because there are so many outdated articles on there. There's misinformation. It's absolutely frightening. But that is the first place we all look. It's often very difficult to find information. And as Dr. Griever said, this can be a very isolating experience. And in our case, the whole time Sarah was going through treatment, Sarah was in college when she was diagnosed. She was 22, and actually she was diagnosed a week before graduating. And so she was treated, she was at school at the University of Washington in Seattle. She was treated at Fred Hutch out there. And I moved out there, I became her caregiver, and the whole time she was undergoing treatment, we never met one other person or family who was dealing with multiple myeloma. It was so isolating. It was scary. We did learn to navigate the internet and find the resources we needed, but we never had an opportunity to talk to anybody else who was going through this. We were completely alone in this, and that's difficult. Also, the bigger thing for us was that we never met a survivor. It would have been very helpful for us while we were sitting in the infusion rooms and so on, to be able to talk with someone who was a year out from diagnosis, or 10 years out, even though we knew the statistical survival rate was 2 to 4 years. That would have brought so much to us. Just a little side note, a friend of mine saw an article in Time magazine. It was a tiny little blurb showing a gentleman swinging a golf club. And I don't even know why it was in Time magazine at that time, but there was a little blurb that said, James Bond of Shaker Heights, Ohio, a multiple myeloma survivor of 13 years, hits the links. And this friend gave me this magazine, and I put that up. I had no idea who this James Bond was, but I just kept looking at that and thinking, he's 13 years out, and he's out golfing. And that was my one thread of hope. I've since met Jim Bond. He's spoken at some of our events. He's now 22 years out and going strong. But those kinds of things are very important. You have the opportunity to use these challenges, turn lemons into lemonade. Ask patients what they need, and you can help to provide that. What would be the most helpful information for them to receive at diagnosis? What would be the most helpful information for them to take with them? I'm sure you all know that when you've been hit with some news that is totally foreign to you and frightening, you need to hear it more than once. Your head is reeling and it's a little bit hard. What information can patients take with them? And what's the best delivery method for information? Although Sarah was 22 when she was diagnosed, the average age of a myeloma patient is 65 to 70 years old. So that's the average age. So there are people in their 80s who are dealing with myeloma. My 80-year-old mom was very adept at the computer and Facebook, but not everybody is. And so think about the delivery methods for imparting information. And then, and I know that my colleague Margie is going to touch on this more, but ask patients what they want most out of research. Is it a cure? Do they want quality of life comforts or something else? Ask the patients. I can tell you that anywhere I've been, patients have never been asked what would be valuable to them. What do organizations like MMORE want regarding rare disease research? We want collaboration, and I'm so thrilled that you emphasize that, Dr. Griever. It's so disheartening to try to get researchers together and find out that their institutions won't allow them to be part of a group effort or even part of a discussion. MMORE hosted an all-day event here at the BRT in 2014, bringing together myeloma researchers from institutions around the country. And there were some cancer centers that would not allow their people to come. It wasn't because of funding, because we could cover the funding, but they did not want their researchers to be sharing ideas. And that's such an antiquated notion. So we want collaboration. That's how things will get going. We'd like to have patient and caregiver access to results. Patients are willing to become involved in research, but would like to hear the results as well, and hear about next steps that you're thinking about as a result of the research you've conducted. Needs and desires, a cure is number one for most people, but also resources, not just financial aid resources, transportation resources, but where to seek second opinions and the encouragement to do so. Those kinds of resources are needed. Prevention with rare diseases such as myeloma, we don't know how it starts. MMORE is funding some research on myelomogenesis, but we don't know where it starts. That would be a good thing to find out. How can we prevent this? And any genetic and hereditary information. Excuse me. And the biggest point I'd like to make is provide clear explanations to patients and their caregivers about what research is and what it isn't. A quick story about our introduction to clinical trials. After Sarah went through everything, was done with her transplant, one of her doctors who had not worked to establish a rapport at all, so we were a little wary of her, she was a little brusque, said to Sarah at the exit appointment, I'm going to be conducting some research and you might be able to help me. I don't know if you'll qualify though. And that was sort of her introduction to us about clinical trials. And Sarah thought, are you kidding me? First of all, I'm done with treatment for a while, but I have no relationship with you, and why would I want to help you? So that was very short-sighted of us, I know, because there is an altruism in becoming involved in a clinical trial, but it was just such a harsh way to hear about this, and it was absolutely the wrong way. I've since been completely convinced by Dr. Craig Hoffmeister, who is a myeloma specialist here at the James, about the value of clinical trials, and I'm such a strong proponent of them. You can let patients know they won't be guinea pigs. That's, of course, the first thought. And you can also let them know that they're not going to necessarily have a placebo. Most trials don't have placebos. They have standard of care. So I think it's important to let them know your expectations, and ask them their expectations. Are we at time? All right, let me squeeze through. Quick ways to find out about where to reach patients. Support groups, there's local cancer support communities, nonprofit associations such as the Ohio Association of Nonprofit Organizations, and race event sites. Every time you turn around, there's a race for a cause. We have one too, and I'm shamelessly going to plug it. It's coming up on June 4th, and I'll have brochures out here for you, and the money will go to the James. There are races for every cause. Get involved and tap into the populations there. I will leave you there and encourage you to please join us at our Move More race on June 4th. And again, I thank you so much for your work in research.